Hello, this is Joe Roble with DirectNet Marketing, and I'm sitting here with Dr. Robert Newhalfen of NWI Chiropractic. Doc, why don't you go ahead and tell us a little bit about yourself and your practice?
Well, once again, I'm Dr. Robert Newhalfen, Northwest Indiana Chiropractic Health. I'm the president and head physician. We're located, our main location is in Schererville, Indiana, at 221 US Highway 41 inside Omni Fitness. And I have a satellite clinic in Crown Point at 300 North Main Street, across from the AutoZone and the Papa John's. And I'm just a local chiropractic, rehab, and nutrition provider for the people of Northwest Indiana.
That's great. Tell me, what kind of techniques do you use to help people, and what kind of ailments do you happen to see most that you can help them with?
Well, there are a lot of different techniques and conditions that I help. I went to school for chiropractic medicine, which for me entails taking a look at the whole person, not just the head and the neck, but really, from the toes up to the head, watching how a person moves. So movement is my specialty. If it hurts to move, I'm the guy to help you. So there are a lot of techniques that I use to help people move better. I use joint manipulation to help joints that aren't moving well enough move better. I do a lot of muscle therapy and trigger point work to help muscles that aren't doing their job do it a little bit better. And I do a lot of rehab techniques as well. I use some McKenzie therapy, which is one of the most widely used techniques to treat neck and back pain in the world. One unique technique that I use is actually called dynamic neuromuscular stabilization, or DNS. It's a technique out of the Prague, Czech Republic. It's been around for a little bit, but very new to the United States. I'm one of the few people in the Midwest that's versed in some of their techniques, and really, you can use it for so many different things: pelvic floor dysfunction, low back pain, neck pain, TMJ, people with flat feet. I actually can build you an arch most of the time. I would want to evaluate you first, but in most people who are really flat-footed, we can actually build an arch, which is pretty cool.
Wow.
So, I work with headaches. There are a lot of different techniques and conditions I use, but really what I use is geared towards the individual. People come in for all kinds of different ailments, and different people need different techniques. And so the more techniques that I'm versed in, the more chances and opportunities I have to correct whatever problem you have going on.
Wow, that's fantastic. It sounds like you're very well versed. I see all these certificates along your office. I see testimonials from pregnant women to people with migraines to I know that you get referrals from dentists. So there's a lot of ailments out there and conditions that seem like a lot of people can use your help, because you seem to treat the body as a whole, as opposed to, I know a lot of people may have misconceptions about a chiropractor and what they may do, but you seem to be very well-rounded and educated and passionate about what you do. And
yeah, Joe, and just a little bit about my background. I went to National University of Health Sciences in Lombard, Illinois, and we're considered a very integrated chiropractic school, where I was taught by medical doctors, osteopathic doctors, physical therapists, chiropractors, and I was actually the first chiropractic intern to work for the Cancer Treatment Centers of America. I did a clinical rotation there, so very much a multidisciplinary clinician. And so a lot of people, I've had this a lot, where people are like, oh, I have a foot problem or a knee problem. Do I go to the podiatrist or do I go to the surgeon? Well, for a lot of people, I'm a great starting point. If I can help you, I'll tell you. If I can't, I know the right place to send you. So what I tell people is, if you're not quite sure where to go, I'm a great place to start, because not only am I versed in how the body works as a whole, but I'm also educated in that multidisciplinary aspect, where I work very much in a team atmosphere, and get referrals from dentists and surgeons and pain management doctors and everybody in the healthcare system.
That's fantastic. How do people go about scheduling an appointment with you?
Well, you can call my office at 219-322-6942. That phone number applies both to my Schererville and Crown Point locations. You can schedule an appointment that way, or you can go on my website at nwichiropractic.com and find all my contact and office hours on there. You could also, once again, my email is on my website. You can always shoot me an email and just, ask a question, or if you have a question, or, if just you're not quite sure what you want to do. I'm great about answering phone calls and responding to emails really quickly. So, if you have a question for you or for somebody about how to schedule an appointment, or if you don't even know if you want to schedule one, call and ask. I'll let you know if it's the right place for you. And if it's not, I can make a potential recommendation to somewhere else where it might be. So.
Well, there you have it. If you need a chiropractor in Northwest Indiana, call Dr. Robert Newhalfen, or Dr. B as his patients call him, and you got all the information right here. So thank you, Dr. Newhalfen.
Thanks, Joe, and have a great day.
Take care.